Okay, welcome back guys. Now in this class, let's discuss about the restrictive lung diseases. Also, let's discuss about the lung cancers. Okay, having said that, now the restrictive lung diseases, RLDs. In yesterday's class, we have discussed about the OLDs, obstructive lung diseases. That includes asthma, emphysema, chronic bronchitis and bronchiectasis. In yesterday's class that we have discussed. Now in this today's class, let's discuss about the restrictive lung diseases, RLDs. Now in this restrictive lung diseases, the main category of the diseases, which are the pneumoconiosis, that I am going to discuss. The pneumoconiosis, sir. Pneumoconiosis means occupational lung disorders leading to restrictive lung diseases. Okay, occupation. These are the occupational lung disorders. There are certain occupations which can damage the lungs in such a way. Now there is a restriction in the expansion of the lungs. Now the lungs are not getting expanded. Now there is an inspiratory problem. Okay, now try to understand something like this. Now during inspiration, the lung should expand, the alveoli should expand, the alveoli should be compliant enough to take the air in. Now there are certain occupations which will cause the lung fibrosis, pulmonary fibrosis. So they are called as a pneumoconiosis. Pneumoconiosis means occupational lung diseases which will cause pulmonary fibrosis. That's a restrictive lung disease. Okay, now we'll discuss about one by one. The restrictive lung diseases, we are going to discuss about them. We are going to discuss about the pneumoconiosis, sarcoidosis. Okay, we'll discuss about every damn thing. Okay, having said that, without any further late, now let's begin our topic. The first pneumoconiosis that I am discussing here is called as silicosis. Okay, silicosis. Now, what exactly is silicosis? Silicosis is also called as aka Grinder's disease. Grinder's disease. Okay, now it is seen in which people? So grinders, like those persons who are involved in the grinding the things, breaking the the rocks, are those persons who are involved in the mining. Okay, so imagine now I'm a person who is doing all this work, like some sort of mining or grinding. So the silica particles, okay, especially the quartz, okay, quartz particles, they will enter into my lung. Now my macrophages, my alveolar macrophages, do you think my alveolar macrophages can remove that quartz particles, the silica particles? Okay, no, definitely not, definitely not. So what the silica particles will do there? They are going and settling in my alveolus. My alveolar macrophages will try to remove them, but they couldn't. So what happens? More damage will occur in the lungs. So damage is going to be healed by fibrosis or scar formation. So pulmonary fibrosis will occur at the end of the day. So the silicosis is also called as Grinder's disease. What it will cause is, it will cause something called as a nodular fibrosis of the lungs. Okay, it causes nodular, the form of nodules, a nodular fibrosis of lungs. So a minor who is having a nodular fibrosis of the lungs, you should always think about restrictive lung disease. That's a silicosis. Okay, silicosis. Now, what's the most common particle that's getting deposited? So these microparticles, these quartz particles, okay, will go into the lungs and they will settle there. Okay, smaller the particle, they will go deeper into the lungs. Okay, so the most common particle is going to be quartz. Okay, the quartz. Okay, so what should be the particle size? The particle size 0.5 to 5 micron. These particles can easily go into your alveolus. Okay, very easily they can penetrate into your alveolus and can lead to this silicosis. Now, some other questions, important MCQs. In silicosis, which parts of the lungs are going to be most commonly affected? Which parts of the lungs? It is, most of the students will think silica is going to get deposited in the lower bases of the lung. No, it's the upper lobes of the lungs are going to be most commonly affected. Okay, upper lobes affected. Okay, upper lobes are going to be most commonly affected. Now, if you do the X-ray, okay, imagine I am the patient who is having silicosis. Whenever you do the X-ray, what you can see is, so this is the X-ray. Now, what you can see is the lymph nodes are getting calcified. In this condition, silicosis, there will be eggshell calcification. Okay, eggshell calcification of the lymph nodes. Okay, so what you will see is right here in silicosis on X-ray finding, there is eggshell, just like an eggshell. Okay, calcification, axial calcification of lymph nodes. Okay, so axial calcification of the lymph nodes is appreciated on X-ray. So this is a very important MCQ. This was the question which was asked. Silicosis. Okay, what you will see on X-ray? Lymph nodes are affected. Axial calcification. Previously, it's thought that so silicosis increases the risk of. Okay, silicosis, it increases the risk of which infection? Previously, it's thought that silicosis increases the risk of TB, but these days it's proven that silicosis doesn't increase any risk for the TB. Okay, so this is the one important point which I want you to know. Next, so if you are working in coal mines, okay, coal mines, you are working with, or imagine you are a coal worker. Okay, not a general, like, general worker. You are working in coal mines. So now it's not the quartz particles that will enter into your lung. It's not the quartz particle. It's the coal particles. The carbon particles are going to enter into your lungs. Now these carbon particles, they will deposit over the time, and it will cause coal worker pneumoconiosis. Okay, the second type of pneumoconiosis leading to restrictive lung diseases that I am talking here is called as anthracosis. Anthracosis, which is also called as coal workers lung disease or pneumoconiosis. Okay, coal workers pneumoconiosis. Now, this disease is also called as silicosis, is also called as a grinder's disease. This anthracosis or coal worker pneumoconiosis is also called as, see, the carbon particles are getting deposited in the lung. So how the lungs are going to look like? Black. So this is also called as black lung disease. Okay, this is also called as a black lung disease. Okay. Now what's the problem? So what's the problem in this anthracosis? If you are having simple variety, the initial phase is simple variety, simple anthracosis. So simple anthracosis can lead to centriacinar emphysema. Okay, MCQ, anthracosis increases the risk of emphysema. Which type of emphysema? In yesterday's class I have explained you, there are different types of emphysema like panacinar emphysema, centriacinar emphysema, paraseptal emphysema, irregular emphysema. There are different types. Having this simple anthracosis, simple variant of anthracosis increases the risk of centri, MCQ, acinar type of emphysema. The centriacinar type of emphysema, and the complicated variety, simple, okay. Now complicated is the real dangerous one. It's going to lead to pulmonary fibrosis. It's going to lead to pulmonary fibrosis. Now, in exams, they will ask you, so these coal workers, right? Coal workers. Now he is having coal worker pneumoconiosis. So that's a black lung disease. He is having coal worker pneumoconiosis. Okay, coal worker pneumoconiosis. These patients, when they develop arthritis, okay, in the future, they are at risk of developing rheumatoid arthritis. Okay. That's the autoimmune disorder where the synovial joints are going to be affected, joint problems. Okay, so rheumatoid arthritis. Now this combo is called as, okay, coal worker pneumoconiosis, that's the black lung disease or the coal workers thing. Now these patients, when they develop rheumatoid arthritis, this syndrome is called as Kaplan syndrome. Okay. This is a question which was asked in FMG exams and NEET PG exams. This is the one thing which you should never forget. Next, after this, the next type of pneumoconiosis which you should know for your exam is asbestosis. Okay. Asbestosis. So asbestos particles. Okay. So those who are working in, especially they will say shipyard workers. Okay, shipyard workers are seen in this asbestosis. It is seen in shipyard, okay, workers. Going to be seen in the shipyard workers. Now, what are the fibers? Which fibers, sir? So in silica disease, it's the quartz particles that are getting deposited in the lung. In the second variant, that's the coal worker pneumoconiosis, the coal particles, the carbon particles are getting deposited in the lung. Now, in this asbestosis, sir, what are these particles that are getting deposited in the lung? Okay, the particles, the fibers which are getting deposited in the lung are, okay, see, there are two types. The most common type is called as, the most common type of fibers are called as the serpentine fibers. Okay, serpentine fibers are the wavy fibers. Okay, serpentine fibers. This is the most common. Next type of fibers are the particles which will deposit in the lung are going to be amphibole, ammocyte. Okay, amphibole, ammocyte. Okay, um, amphibole, ammocyte, crocodolite. Okay, so these are the fibers. So what are the type of particles that are getting deposited in the lung? The most common are serpentine fibers. Okay, the serpentine fibers are the most common fibers that are getting deposited in the lung. Other type of particles which can be deposited in the lung are amphibole, ammocyte, crocodolite fibers. They will deposit in the lung. Now, after getting deposited in the lung, what happens? What is the first lesion? The question which was asked in the exam is, okay, imagine I am the one who is having this asbestosis. Now, in the initial phases, when these particles are getting deposited in the lung, what is the initial lesion that's seen in the lungs? Okay, the initial lesion that is appreciated is a pleural plaque. The pleura is going to be affected. Pleural plaque. Okay, so pleural plaques, you can have a pleural nodule. This is the first thing. Pleural plaque, pleural nodule can be seen, and there is a risk of, okay, in the later stages there is a risk of adenocarcinoma also. Okay, adenocarcinoma. Okay, adenocarcinoma. That is the most common cancer. That's the most common cancer that is seen in the patients who are suffering with asbestosis. It's the most common cancer. But important one thing, guys. Some students might have already have a doubt that something called as a mesothelioma is there. That I will come. That I will discuss. Just wait. See, here the pleura is getting affected. Pleura is getting affected means that pneumoconiosis, the occupational lung disorder, where the pleura is getting specifically affected, is asbestosis. Asbestosis seen in the shipyard workers. The type of particles that are getting deposited in the lung also I have discussed. The point is here, sir, what is the most specific cancer which is seen in this asbestosis? Most specific cancer. The most specific cancer is going to be mesothelioma. Okay, the mesothelioma, sir. The most common cancer is going to be adenocarcinoma. Most of the students will think only mesothelioma. No, most common cancer that's going to be seen in the patient who are suffering with the asbestosis is going to be adenocarcinoma of the lung. But most specific, it's going to be mesothelioma. Okay, mesothelioma, which is not seen in other cases. Mesothelioma is specifically seen in asbestosis. Image based questions are also very important. Look here. Sir, are you able to appreciate this is the pleura? Lung is surrounded by the pleura, right? Now I hope you can appreciate the lung and the entire pleura become thickened because of this tumor cells, cancer. Okay, see how the pleura is. Okay, here also they go how the pleura is. Now the pleura entire, normally the pleura was supposed to be having the pleural fluid, the pleural cavity and the pleural fluid. But what is happening here? The entire pleura is filled with the cancer. Okay, cancer. Okay, see pleural mesothelioma, pleural mesothelioma. Sir. Okay, so done. After this, what else you need to know for your exam? Okay, what else you should know for your exam is, look, sir, in these patients, okay, in these patients, if you look under the microscopy, okay, take a biopsy and look under the microscopy, sputum, what you will look here is, so this person is coughing, and if you look under the microscopy, the sputum, now you will see these asbestosis bodies are ferruginous bodies, okay, right, asbestosis bodies. Okay, these are called as asbestosis bodies or ferruginous bodies. Ferruginous bodies. By looking at it, you should be able to answer. By just looking at it, you should be able to answer. Sir, ferruginous. So what exactly is this? Iron accumulation. Along with this fiber, iron accumulation, sir. So this ferruginous bodies is due to iron accumulation. Okay, iron accumulation or the iron deposition. Okay, so asbestosis bodies or ferruginous bodies are seen in this condition, which is called as asbestosis, seen in shipyard workers. See, now I will be showing you some direct single liner questions which are needed for your exam. See, if you are having pulmonary fibrosis because of some reason, idiopathic. See, pulmonary fibrosis most common causes. The pulmonary fibrosis most common cause is idiopathic. Of course, in other conditions also, in other occupational lung diseases also, there is pulmonary fibrosis. But most common cause of pulmonary fibrosis is idiopathic. We don't know why it is happening. If you look at a lung which is having pulmonary fibrosis, it is going to show you honeycomb appearance. And that's a question asked, honeycomb appearance of the lung. Honeycomb lungs is seen in pulmonary fibrosis, idiopathic pulmonary fibrosis. So bodies which are seen in asbestosis under microscopic, okay, ferruginous bodies also called as asbestosis bodies, iron accumulation. Most specific tumor seen in asbestosis, most specific is mesothelioma, most common is adenocarcinoma. Anthracosis seen in and known as, it is seen in coal workers and it is also called as black lung disease, you know it. Pulmonary fibrosis seen in aerospace industry, those workers who are seen in who are working in the aerospace industries, shipyard completed, aerospace industry workers, they will get something called as berylliosis. Okay, beryllium. Okay, berylliosis, sir. Okay. Next, what is bacinosis? The weavers, those who are working in the this cottage industry, the weaving things. Okay, so cottage, the weaver industries, they will be always doing with the the cotton, right? Okay, the weaving the things, weavers. Okay, so due to the deposition of cotton dust, okay, organic dust, cotton dust or organic dust, these organic dust particles are going to go and deposit in the lung. That's going to cause the bacinosis. Bacinosis. Now, what is bagosis? Bagosis is because of the deposition of sugarcane dust. Okay, the sugarcane workers, those who are always working in the sugarcane field and the sugarcane processing units. Okay, so these persons will get bagosis. And what is Kaplan syndrome? Already we have discussed. Kaplan syndrome is coal worker pneumoconiosis. Coal workers pneumoconiosis along with rheumatoid arthritis is called as Kaplan syndrome. Bagosis, sugarcane dust. Bacinosis, cotton dust. Okay, next. This bacinosis is there, right? It is also called as Monday chest syndrome, sir. Okay. Bacinosis. What is bacinosis? The cotton, the weavers, seen in the weavers. It is also called as Monday chest syndrome. Okay, Monday chest syndrome. Because Sunday will be a holiday, again Monday the person is going to go to the mill and he's going to work and again he's going to have the symptoms, Monday chest syndrome. Now, what is stenosis? Stenosis, sir, stenosis. Bagosis, you know, bacinosis, you know, stenosis. Stenosis is because of inhalation of tin oxide. Okay, tin oxide. Now, if you take this tin oxide, the tin oxide is getting deposited in the lungs, that will cause stenosis. So, some important pneumoconiosis are completed, sir, like bacinosis, stenosis, bagosis, Kaplan syndrome, okay, Kaplan, coal worker pneumoconiosis, silicosis. Okay, so these are some important pneumoconiosis which can lead to restrictive lung diseases where there is pulmonary fibrosis and restriction in the lung expansion. Okay, now the next thing which I want you to know is very important topic which I want you to know is called as sarcoidosis. Okay, sarcoidosis, sir. Now, for your exams, what you should know regarding the sarcoidosis. Okay, for your exams, what you should know regarding the sarcoidosis. See, why sarcoidosis? What is sarcoidosis and why sarcoidosis? Remember one thing, no one knows why sarcoidosis is occurring. What happens in sarcoidosis, I will tell you. But what is, why sarcoidosis is happening? Etiology, we don't know. Etiology, unknown. Okay, so what is there, sir? What is happening? Sir, in sarcoidosis, many tissues, not just in the lung, in many tissues, granulomas are going to form. So you know the granulomas, right? Granuloma formation. Okay, focus of chronic inflammation surrounded by the epithelioid cells, giant cells. Okay, you know it. Sarcoidosis etiology we don't know. What you will see? Non-caseating granulomas. So there is no case, like there is no necrosis. Okay, so non-caseating. Okay, you know the caseating necrosis, right, which is seen in the TB condition. So non-caseating granulomas are seen in sarcoidosis. Okay, see, sarcoidosis also have caseating granulomas, but mostly non-caseating granulomas are seen. Okay, caseating, note, just take a note, important point. Note, even caseating granulomas are also seen, but mainly it is non-caseating granulomas. Now, if you look under the microscopy, okay, if you take a biopsy and if you put it under the microscopy, what you will see is such kind of appearance is seen. See how it is looking like. So what are these? Sir, what are these? Sir? These are called as asteroid bodies. Under microscopy, what you will see is asteroid bodies. Okay, asteroid bodies. Asteroid bodies are seen in which condition? Sarcoidosis. Okay, not only that. Okay, let me tell you one more thing, sir. Not only in sarcoidosis, there is one more condition. Okay, there is one more condition where you will see asteroid bodies. Can you tell me, sir? This is also asteroid body. This is also an asteroid body, but this is not seen in sarcoidosis, sir. Skin infection. Okay, it's a deep fungal infection, sir. Okay, so can you tell me what is this condition called as? It's called as sporotrichosis. There is a condition called as sporotrichosis because of this thorn prick. Okay, whenever you are having in a rose garden, when you are working in a rose garden and you are having a thorn prick, okay, because of this organism called as Sporotrix cheniki, this organism, you are going to have this disease which is called as sporotrichosis. It's a deep fungal infection. Okay, deep fungal infection. Sporotrichosis also shows asteroid bodies. Okay. So just as an integration, I am telling you, asteroid bodies are seen in sarcoidosis as well as in sporotrichosis. Do you know what is the other name for sporotrichosis? I have said you. When you how you will get this sporotrichosis? By having a prick, thorn prick, rose. In the you are working in rose garden and there is a thorn prick. So this is called as rose gardener's disease. So usually those people who are working in the rose gardens, who are taking care about the rose gardens, so that gardener is going to get this rose gardener's disease or sporotrichosis. And here you see the this is how the lesion is going to be involved. Linearly there is involvement, linear involvement. Okay, that you will study in your microbiology anyway. Just leave it. Now after this, what else I should know? I should teach you. So in this sarcoidosis, again under microscopy, histology, okay, again under microscopy, you can see these blue color dots, right? Blue color dots which I am highlighting. So what exactly are these, sir? What exactly are these? See, they are called as Schumann bodies. Okay, they are called as what? Schumann bodies. Okay. Okay, these are called as Schumann bodies. So what exactly are the Schumann bodies, sir? See, these are calcium depositions. Okay, these are calcium depositions. See, sarcoidosis is the one condition where the calcium levels will be elevated. Calcium levels are going to be elevated in the sarcoidosis, sir. Okay, so what you are seeing, Schumann bodies can be seen. Next one, asteroid bodies can be seen. Okay, asteroid bodies can be seen. What else? Now, if you look at here, sarcoidosis, see, these are all granulomas, sir. Okay, these are all granulomas. Okay, these are all granulomas. Normally granulomas are surrounded by the lymphocyte. There is a lymphocytic collar, yeah, surrounding the granuloma. See, focus of chronic inflammation, where epithelioid cells are there, giant cells are there. Okay, epithelioid cells, giant cells, macrophages are sitting. Now, here is a granuloma. Granuloma is surrounded by the lymphocytes. Okay, so the T lymphocytes are going to form the granuloma, especially T helper 1 cells. The T helper 1 cells are going to form the form a collar which is called as a lymphocytic collar. Okay, there is a collar, or I should say the boundary. There is a boundary for the granuloma which is formed by the lymphocytes. But in sarcoidosis, the granulomas do not have that lymphocytic collar. There is no collar around it. So these granulomas are called as naked granulomas. Okay, so naked granulomas of sarcoidosis. Okay, so there is no lymphocytic collar. There is no lymphocytic collar, so these granulomas are called as naked granulomas. Very important. Okay, very important. Now, after this, what are the laboratory findings which you can see in sarcoidosis? So it's a granuloma formation. Simple sarcoidosis is a condition where there is granulomas are forming in the body. We don't know why. We don't know why. Okay. So what you can see in the labs, laboratory findings. Okay. So laboratory findings, 3 laboratory findings that I will tell you. Very important laboratory findings. One is these patients are going to have elevated ACE levels, angiotensin converting enzyme levels are elevated. Elevated angiotensin converting enzyme levels, ACE levels are going to be high. Second thing is elevated calcium levels. Even when I am discussing about the endocrine topic, okay, I have explained you this. The calcium levels are going to be elevated in hyperparathyroidism, you know it. So here also the calcium levels are going to be elevated. Calcium levels are elevated, sir. Right? Now the third condition, okay, the third condition, or I should say, like, the third finding, the third laboratory finding which you can appreciate in these patients is, so the ratio, the CD4 to CD8, the CD4 to CD8 ratio is going to be elevated. Okay, CD4 cells, you know, right, the CD4 cells and CD8 cells, the T cells, CD4 and CD8. So CD4 cells to CD8 cell ratio is going to be elevated. This is very, very important. Let me tell you here. Normally, the ratios are CD4 to CD8 ratio, okay, is going to be 2:1. 2:1. Sir, in which conditions this ratio will go down? In which conditions this ratio will go down? In HIV. In HIV condition, this ratio will come down. Sir, in which condition this ratio is going to be increased, elevated? It is going to be elevated in sarcoidosis. Okay, in sarcoidosis, this ratio is going to be elevated, sir. So what are the 3 laboratory findings which can be appreciated? Angiotensin converting enzyme levels or ACE levels is going to be elevated. Serum calcium levels are going to be elevated. The serum calcium, as it's getting elevated, calcium will try to come and getting deposited. Okay, calcium will come and try to deposit in multiple areas. That's the metastatic calcification can occur. Okay, because of high amounts of calcium in the blood, the calcium will go and try to precipitate in different areas, leading to metastatic calcification. Now, long back, this test was used to do for the diagnosis of this sarcoidosis. The name of this test is called as, okay, so there is this intradermal skin test. Let me write, very important, intradermal skin test. The intradermal skin test which is done for sarcoidosis. Any idea? QM test. Okay. QM. So QM test is an intradermal, very important for your exams. QM test is an intradermal skin test which is done for the sarcoidosis. Okay, sarcoidosis. Important point, sir. Okay. Now, what else is left over in the sarcoidosis? What else I should teach you? Okay, test that is done, intradermal skin test, which is used to put the diagnosis completed, laboratory changes completed. On histology, what you will see is the naked granulomas, Schumann bodies can be seen, asteroid bodies can be seen. Okay, we don't know what is the etiology. Non-caseating granulomas are going to be seen, but also caseating granulomas are going to be seen. Now, I should teach you the associations. Okay, associations. Associated with this sarcoidosis is one condition, it is associated with. Any other condition, it's associated with Lofgren syndrome. Lofgren syndrome. And also one more syndrome which is called as Hereford Waldenstrom Hereford Waldenstrom syndrome. So Lofgren syndrome, this is important, sir, little important. Lofgren syndrome is associated with sarcoidosis. Lofgren syndrome is associated with sarcoidosis, sir. Okay, in Lofgren syndrome, not only sarcoidosis, but also let me show you if here see in Lofgren syndrome there is lymphadenopathy, hilar lymphadenopathy can be seen in the hilar region, hilar lymphadenopathy can be seen, and polyarthritis can be seen, and skin involvement, erythema nodosum can be seen. Lofgren syndrome. Okay, so in Lofgren syndrome, the patient is also going to have this sarcoid granulomas. Okay, sarcoid granulomas are seen, sir. So with this, sarcoidosis is also completed. Now after this, what else you should know is lung cancers. Let me teach you now lung cancers. Now my question to you, first question to you, lung cancers. How many types of lung cancers do you know? How many types of lung cancers do you know? So there is something called as squamous cell carcinoma of the lung, squamous cell carcinoma of the lungs. Next, this is the first type. Second one, adenocarcinoma of the lung. Next type is small cell, which is also called as oat cell carcinoma of the lung, and the last one is large cell carcinoma of the lung. So these are the 4 types of lung cancer: squamous cell carcinoma, adenocarcinoma, small cell carcinoma, as well as the large cell carcinoma. Now question to you is, sir, out of all these types, which types of cancers are going to be located in the center and which are located in the periphery? The periphery, either in the top or bottom, which are located in the center. Central cancers are what? And what are the cancers which are located, which are going to occur in the periphery, sir? So I used to remember something like this. Sir, squamous, small cell. Okay, squamous and small cell, they're starting with the letter S. S for something like central, right? Okay, central, C and TRAL, but SC and TRAL, you can also write something like that. Okay, so squamous cell carcinoma is located in the center. Okay, central location. This is also going to locate in the center, central. Now adenocarcinoma, where it is located? It's located in the periphery. It is also large cell, also going to look in the periphery. Okay, so done. So whenever you are having a clinical question where they say they have done the X-ray or CT or MRI, and they are saying that the cancer is located peripheral in location. So if it is located peripheral in location, you should always think about either it's adenocarcinoma, okay, or large cell carcinoma. Most probably it will be adenocarcinoma only. Adenocarcinoma or large cell carcinoma. If it is located in the central region means either it should be squamous cell carcinoma or small cell carcinoma. Okay. Next, sir, smokers. Usually, the cancers are going to cause the smoking is going to cause a lung cancer. Now in smokers, what type of cancers are seen? Smokers. Okay. Now imagine there is this one person who is a smoker. Now he is worried. Okay. Now he is worried. He might get a cancer. Now, yeah, he will get a cancer. But which type of cancer? Which type of cancer? See, again, smokers starting with the letter S, same, squamous cell carcinoma and small cell carcinoma. Okay, and where they are located also, their location is central. Okay, their location is central. And sir, non-smokers. Okay, good fellows, non-smokers. Okay, so these non-smokers will also get the lung cancer, sir. Okay, there is a chance that they will also get the lung cancer. But which type of lung cancer? Adenocarcinoma. Okay, adenocarcinoma is going to be seen in non-smokers. Now after this, what else I should teach you? Sir, genetics involved. What are the gene mutations which will lead to different types of cancer? Which gene mutations, sir? See, the 3 important gene mutations which you should know is, for example, let me write here, genetics. Okay, first in squamous cell carcinoma, next adenocarcinoma, and next small cell carcinoma. Okay, small cell carcinoma. Now in squamous cell carcinoma, which genes are mutated? It's a P53 gene mutations. Okay, so it's the P53 gene mutations which are seen. P53 gene mutations are going to cause the squamous cell carcinoma. Next, adenocarcinoma is going to be seen in which people, sir? So that people are those people who are having EGFR, okay, epithelial growth factor receptor gene, EGFR1 gene mutations. Okay, the mutation of EGFR1 gene and ALK gene activations, like gain of function mutation of ALK and KRAS gene mutation activation. So EGFR1 gene mutation, ALK gene mutation and KRAS mutations can lead to adenocarcinoma of the lung. And next, small cell carcinoma of the lung. This is very important for your exams. So small cell carcinoma of the lung, it is because of which type of gene mutations? So it's because of LMIC gene amplification. Okay, LMIC amplification. Okay, LMIC amplification. In endocrine also I have discussed about one mixer, NMIC. Okay, NMIC. Sir, NMIC amplification is seen in neuroblastoma. Okay, NMIC amplification is seen in neuroblastoma. LMIC amplification can cause small cell carcinoma. Okay, let me write all the mix in one place, sir. All this MYCs. Okay, so how many types of this mix are there? These are the transcriptional, factors. CMIC, LMIC, and NMIC. See, already I have said you NMIC amplifications. NMIC amplification is seen in N for N, neuroblastoma. What is neuroblastoma? Neuroblastoma is a tumor of adrenal medulla in the children. It's a tumor of chromaffin cells. It's a tumor of arising from the neural crest cells, the chromaffin cells, neural crest cells, and they are forming the tumor, sir, and they are forming the tumor. Okay. So NMIC amplifications are seen in neuroblastoma. Just now, okay, N for N completed. Just now we have discussed L for L, LMIC amplification seen in lung cancer. Which lung cancer? Small cell cancer of the lung, small cell cancer of lung. And CMIC amplification. Now, guys, are you able to appreciate what is this? This African child who is having lymphadenopathy, this is a cancer, sir. So his cheek is getting affected. Whenever you see this, immediately one thing will come into your mind. Okay, for every medicine students, this is the favorite image. Just by looking at it, you can answer a child, an African child who is having swollen cheek lymphadenopathy. It's a cancer, sir, actually. So what exactly? It's C for cheek. So I used to remember CMIC, cheek. So this is the Burkitt's lymphoma. Okay, Burkitt's lymphoma. So these are these three mix which I want you to know, sir. Okay. Next, what else I should teach you is, sir, how the histology is going to look like. Sir, in squamous cell carcinoma, in adenocarcinoma, in small cell carcinoma, what are appreciated? Okay, let me first show you. See, you just by looking at it, tell me, sir, it's which type of cancer? Now I am telling you this is a lung biopsy, sir. Okay, I am telling you this is a lung biopsy. The biopsy is taken from the center of the lung. The biopsy is taken from the tumor which is arising from the center of the lung. Now I am showing you. Now you just tell me, what is this cancer? Just by looking at it, you can answer. Sir, what you are saying? Sir, what is this? So these are keratin pearls, keratin pearls, sir. Keratin pearls are seen in which type of cancers? Squamous cell cancers. Whenever you see the word keratin pearl, that's it. It's a squamous cell carcinoma. Okay, it's squamous cell carcinoma. Next, the second type. Okay, again, I have taken the biopsy from the cancer. Now, just look at it and tell me what kind of cancer it might be. Sir, in the histology, I hope you look at these things, right? What are these? What are these, sir? These are all the glands. These are all the glands, sir. Okay, so glands means what? Adenocarcinoma of the lung. Adenocarcinoma of the lung. Okay, now next type. So this is also the histology where you can see this is the blood vessels where the walls of the blood vessels are staining the blue color. The walls of the blood vessels are staining this blue color. So this is called as azoparity effect. This azoparity effect is seen in, okay, the azoparity effect, it is seen in small cell carcinomas. So let me write one by one. Keratin pearls. Keratin pearls are seen in squamous cell carcinoma. Next, glands are present in adenocarcinoma. Okay, here also see the frozen section with the mucinous lung adenocarcinoma. Here it was given. Okay, adenocarcinoma. Adenocarcinoma of the lung. And the last one, what is seen here is esophageal effect. Esophageal effect. So what is this esophageal effect? Esophageal effect. Okay, that's the staining of the blue color. Staining the blue color. It is seen in which cancers? Small cell or oat cell. Small cell carcinoma or oat cell carcinoma, sir. Then in the small cell carcinoma, okay, in the small cell carcinoma, in normal H and E stain, you can see the cells. It's not clear over here, but you can see the salt and pepper appearance. The salt and pepper chromatin is seen. Salt and pepper chromatin. Okay, so there is seen the fine nuclear chromatin, which is looking like a salt and pepper, the white and blacks, salt and pepper. Okay, so salt and pepper chromatin, it is seen in small cell carcinoma or oat cell carcinoma of the lung. Okay, that's the one important point which I also want you to. Okay, right. So after this, some direct questions. Sir. What is the most common cancer causing the death worldwide? Is the lung cancer. Okay. Now, what is the most common cancer of the lungs? The most common cancer of the lungs are always secondaries. Usually, primary lung cancers are rare. Primary lung cancers are rare. That's the small cell carcinoma, squamous cell carcinoma, large cell carcinoma, adenocarcinoma. They are rare, sir. They are rare. Secondary cancers means from metastasis. Cancer have originated somewhere in the body and now it's coming and getting deposited in the lung and it's growing. So secondary cancers are most common when compared to the primary cancers. Okay. Next, so oat cell carcinoma of the lung is also called a small cell carcinoma. Okay. Okay. See, lots and lots of questions will come in your exam from this one thing. Small cell carcinoma, oat cell carcinoma. It's a deadly thing, sir. It will kill you. Okay. So worst prognosis. So oat cell carcinoma is having, so prognosis is worst. Okay. I have discussed there is Elmic amplification. Okay. See, whenever you are, whenever the person is having this small cell carcinoma, he is going to show the paraneoplastic syndromes, which means the cancer, it's not simply growing and simply not metastasizing. It will produce different types of hormones. Okay, it will produce different types of hormones. Normally, antidiuretic hormone, it was supposed to be produced in the hypothalamus. Okay, antidiuretic hormone was supposed to be produced in the hypothalamus, the supraoptic nucleus of the hypothalamus. But if the person is having the small cell carcinoma of the lung, the cancer is also going to produce antidiuretic hormone. So inappropriately, the antidiuretic hormone is getting produced. So this is called as SIADH, syndrome of inappropriate antidiuretic hormone synthesis. That is the most common paraneoplastic syndrome. Para means side to the neoplasia. Okay, so paraneoplastic syndrome, side to the neoplasia. Apart from cancer, what else? They will produce hormones like antidiuretic hormone. Whenever there is so much amount of antidiuretic hormone, it will cause SIADH. So the person is going to produce concentrated urine, oligouria, concentrated urine. The patient is having now volume overload. The fluids are getting retained in the body. The urine is not coming out. So the fluid accumulation will occur. Okay. So there will be dilutional hyponatremia, all those things later on. So one important point is the small cell carcinoma of the oat cell carcinoma is associated with the paraneoplastic syndromes. True. These patients will produce the antidiuretic hormone. Okay. And also they will produce ACTH. ACTH means what? Adrenocorticotropic hormone. Whenever there is so much amount of adrenocorticotropic hormone, that will stimulate the adrenal gland to release more cortisol. That more cortisol steroid will cause Cushing syndrome. SIADH and Cushing syndrome can be seen. True, sir. True. Now, lung cancer, that is going to be associated with the gynecomastia. Okay, lung cancer, the gynecomastia means large breasts. Okay, the breast is getting larger, especially in males. Okay, male, like developing the breast. So I used to remember, okay, gynecomastia, the breast is getting larger in size in the male. It's because of large cell cancer. So large cell lung cancer makes the breast large, male breast large. Okay, gynecomastia. Okay, usually students will know this, right? The lung, what are the causes of gynecomastia? Disco drugs, DISCO, disco drugs, digitalis, isoniazid, spironolactone, cimetidine, estrogens. Yes, they will cause gynecomastia. Okay, but which cancer can cause gynecomastia? The large cell carcinoma of the lung. Okay, even tumors, prolactinomas can cause gynecomastia in the males. Okay, but anyway. Next, lung cancer associated with the hypercalcemia. This is the recent NEET PG question, sir. Recent NEET PG question which was asked in the last NEET PG. Okay, so if a person is having squamous cell carcinoma of the lung, just like this, Oat cell carcinoma. Oat cell carcinoma is going to produce SADH. ACTH, okay. But the squamous cell carcinoma of the lung, it will produce, squamous cell carcinoma of the lung, it will produce something called as parathyroid hormone related peptide. Okay, parathyroid hormone related peptide. So parathyroid hormone like hormone, this squamous cell carcinoma is also going to produce parathyroid hormone related peptide, like peptide. So what parathyroid hormone will do? Increase the blood calcium levels. So here also this squamous cell carcinoma, it produces something similar to the parathyroid hormone, so it increases the blood levels of calcium. Okay. Next, what else? So squamous cell carcinoma completed, large cell carcinoma completed, small cell carcinoma completed. Now adenocarcinoma. Adenocarcinoma. So this adenocarcinoma, which is seen in the non-smokers, adenocarcinoma, non-smokers. Adenocarcinoma, what is the paraneoplastic feature? Okay, apart from cancer, what else it will show? It will cause migratory thrombophlebitis, inflammation of the veins. Okay, migratory thrombophlebitis is associated with adenocarcinoma. Okay. So you know it already, the adenocarcinoma is going to be seen in non-smokers. Okay, non-smokers. The lung cancer which is associated with the Horner syndrome. I will explain you about the Horner syndrome. Okay, the lung cancer which is associated with the Horner syndrome, especially the answer is the Pancoast tumors. So the Pancoast tumors, I will explain you. The tumors which are arising in the apex of the lung. Okay, there are tumors called as the Pancoast tumors. They will arise in the apex of the lung. They will, do you know what they will cause? I will show you, but just now remember, just for now remember, Pancoast tumors are associated with the Horner syndrome. What are these Pancoast tumors, sir? I will explain you. They are going to arise in the apex of the lung. Okay, so now tell me, migratory thrombophlebitis, adenocarcinoma. Non-smokers, adenocarcinoma. LVIC amplification, okay, LVIC amplification, small cell carcinoma of the lung or oat cell carcinoma of the lung. Hypercalcemia, okay, hypercalcemia, parathyroid hormone related peptide, squamous cell carcinoma. Azoparity effect, small cell carcinoma. Salt and pepper chromatin, small cell carcinoma. Keratin pearls, squamous cell carcinoma. Gynecomastia, large cell carcinoma. Okay, so this is how you should, like, always repeat the things. Okay, these are the questions which will come in your exams. Okay, so anyway, now after this, what else you should know? What else you should know? Okay, same. So directly let me show you here. So this adenocarcinomas, I have explained you already. Adenocarcinomas, they are the most common type of tumors in the non-smokers. They are the most common type of tumors in the non-smokers. Not only that, see, not only that. So what is the most common type of tumors in the females? Okay, what is the, specifically females, usually they won't smoke. Okay, when compared to the males, okay, especially in this part, okay, in the Asian countries, the females, they usually don't smoke. So even without smoking, they will get the cancer. What kind of cancer? Adenocarcinoma. See, in non-smokers. Okay, children also. What is the most common type of lung cancer in the children? Adenocarcinoma. Females, adenocarcinoma. Non-smokers, adenocarcinoma. What is the most common overall? Most common overall lung cancer is also adenocarcinoma. Adenocarcinoma, okay. Where they are located, adenocarcinomas? Adenocarcinomas are located in the periphery, in the peripheral regions. Okay, they are located in the peripheral regions. Okay. Now, one more question which was asked in the exam is done. Till here, adenocarcinomas are completed. Okay, adenocarcinoma is completed. Now, the lung cancer, in which type of lung cancer? You are going to have cavitations. Cavitation means hollow spaces. So, cavitating lesions are seen in which type of lung cancers? Cavitating lesions are seen in squamous cell carcinomas. So, squamous cell carcinomas, keratin pills, okay, hypercalcemias, you know it, right? So, squamous cell carcinomas seen in smokers, central location. They are going to cause cavitating lung lesions. Cavitating lung lesions. Done. Okay, here also okay done. Now, if you are if the person is having a lung cancer, like if the person is having lung cancer, the cancer is going to metastasize, right? The cancer is going to metastasize. What is the most common site for the lung metastasis? What is the most common site for the lung metastasis? Okay, what is the most common site? For lung cancer, what is the most common site for lung cancer mets? The answer is adrenal gland. Okay, and liver, both are the most common sites. Okay, so liver and adrenal gland 50-50%, they are the most common site for the lung cancer metastasis. Now, after this, I have to teach you some important points about the Horner syndrome. What exactly is the Horner syndrome, sir? Okay, Horner syndrome, what exactly is it? See, Horner syndrome means, first let me show you the image so that you will have a better understanding. Look here. Now, See, where is the cancer now? The cancer is present in the apex of the lung. That's the apex. Okay, this is the, you can appreciate, right? Very well appreciate, that's the neck. Now the cancer is in the apex of the lungs. This is the cancer. Okay. Now what this cancer is going to do, right? Normally the sympathetic nervous system, what it is also called as, the sympathetic nervous system is also called as thoracolumbar outflow from the thoracic region and from the lumbar region, from the thoracic region, from the lumbar region. These thoracic spinal nerves and the lumbar spinal nerves, they carry the sympathetic fibers. They carry out the sympathetic fibers. And these sympathetic fibers, whatever are coming out, they will regulate the sympathetic activity in the body. Okay, they will regulate the sympathetic activity in the body. Now, in our head and neck also sympathetic activity is there. What is that? Pupillodilation, sweating. Okay, pupillodilation, sweating is there. So, pupillodilation, sweating is a sympathetic activity. Normally, the sympathetic activity is the one which keeps my eyelid open. Okay, to keep the eyelids open, sympathetic activity is also playing an important role. The sympathetic activity causes the contraction of the Muller's muscle. So, the eyelids are kept open, sir. Okay, right now say, I am just looking at you. I am not keeping my eyelids voluntarily open. Okay, yes, of course I can control my eyelids voluntarily. Okay, somatic. But normally when I am like this, my eyelids are kept open by sympathetic nervous system. So, because of this tumor, do you know what happens? Sir, this tumor, it will grow and it will compress. Normally the sympathetic neurons, they will ascend up like this. The sympathetic neurons, they will ascend up like this. Now, because of this tumor, what happens is the tumor is going to compress the sympathetic neurons. So, there will be loss of sympathetic supply to the head and neck. Okay, the sympathetic supply to the head and neck is going to be lost. So, that's what is going to cause the Horner syndrome. So, in Horner syndrome, the patient is going to have ptosis, meiosis, and hydrosis. Ptosis means what? Drooping eyelid. And meiosis means what? The pupilloconstriction. Okay, pupilloconstriction, the meiosis. And anhydrosis, what exactly is anhydrosis? Anhydrosis means no sweating. The sweating in the head and neck is not going to occur. So, anhydrosis. And in ophthalmos, sunken, like the sunken eyeballs are also going to be little sunken. That's going to be seen. Okay, these are the important points which I want you to know. The other things you can remember, you can forget about the loss of sphenospinal reflex. No need to remember that, small details. Simple. Ptosis, meiosis, anhydrosis. These three are the triad symptoms in a patient who is suffering with Horner syndrome. Okay, in Horner syndrome, these are the three things. In Horner syndrome, what is happening? There is a loss of sympathetic supply to the head and neck. Loss of sympathetic supply to the head and neck. Okay. Next, what else I should teach you? The lung hematomas. Sir, what exactly are these lung hematomas, sir? Lung hematomas, what exactly are they? The hematomas are the benign tumors, benign tumor of the lung. So, small cell carcinoma, large cell carcinoma, adenocarcinoma, squamous cell carcinoma, all these are the malignant cancers. Okay, all these are the malignant tumors. But what are the benign tumors? Hematomas. So, hematomas are the benign tumors. Okay, so look here. Let me show you. See, now this is an image based question which was asked in the exams. Now, here you can see, right? So, there is calcification occurring and it's looking like almost like a popcorn. It's looking like a popcorn. So, popcorn calcifications are seen in hematoma of the lung. Hematoma of the lung. Okay, look here. A 20-year-old male came to the medical checkup. The CT of the chest, it is suggesting something like this. Now, the CT of the chest. Now, here in the lung. So, these are the lungs, two lung fields. Here, you can see something like this, right? So, it's looking like a popcorn. Okay, so popcorn appearance is going to be seen in hematomas. And what are hematomas? Hematomas are benign tumors, benign tumors. What you can see here? So, here the pupil like this and here the pupil is constricted, and not only that, in this side there is drooping eyelid, means this side of the face, means on this side there is a lung cancer which is causing damage to the sympathetic supply to this side of the face. Okay, so ptosis, meiosis, here also this is normal eye, normally well opened, everything in the pupil is proper. Here what is happening? So, there is a drooping eyelid. Okay, there is drooping of the eyelid, drooping eyelid. Okay, next here, see, when compared to this eye is having a good pupil. Here the pupil size is decreased and there is little ptosis also, there is a little drooping. Okay, so this is Horner syndrome. So, lung hematomas appearance is going to be popcorn calcifications are going to be seen in the lung on CT. What else, sir? So, this the direct single liner question. So, you know about the systemic lupus erythematosus, right? SLE, systemic lupus erythematosus. This SLE, systemic lupus erythematosus, it's a multi-organ disease. The lungs are also going to be affected. In the systemic lupus erythematosus, the MCQ that they will give you is a shrinking lung. Shrinking lungs are seen in, direct single line question, I want you to know this. Shrinking lungs are seen in SLE. Also, we have discussed about this Goodpasture syndrome in the renal pathology also we have discussed. So, it's autoimmune disease. Goodpasture syndrome will cause type 1 RPGN, type 1 rapidly progressive glomerulonephritis. Okay, type 1 RPGN, where the antibodies are produced against the non-collagenous part of type 4 collagen. So, the alveolar basement membrane and the glomerular basement membrane are going to be affected. Now, why I am discussing about this here? Because see, lungs are also having alveolar basement membrane made up of type 4 collagen. Okay, lungs are made up of this type 4 collagen. So, type 4 collagen is present in the alveolar basement membrane. So, there is this one condition called as Goodpasture syndrome, where the autoantibodies will come and attack this type 4 collagen. So, this type 4 collagen in the lungs is getting affected. So, the patient is going to have hemoptysis. Okay. Hemoptysis, and the kidneys are also getting affected because type 4 collagen is also present in the glomerular basement membrane. Okay, glomerular basement membrane. So, the patient is going to have hematuria. Okay, hemoptysis and hematuria are going to be, hemoptysis as well as hematuria are going to be seen. So, single and shrinking lung is seen in SLE. In Goodpasture syndrome, lungs and kidneys are going to be affected. The patient is going to have symptoms like hemoptysis as well as hematuria. What else? Imagine, so the lungs are getting the metastasis from some other place. The lungs are getting the metastasis from some other place. The metastasis is happening to the lungs. So this is how it's going to look like. Now in the lung, I hope you can able to appreciate. See, these cancers are growing. Cancers are growing, sir. So multiple cancers are growing. So this is lung metastasis is happening. Lungs are getting affected. Okay. These metastasis on the X-ray, how they are going to look like. This type of metastasis is called as cannonball. Okay, cannonball metastasis. Cannonball. So cannonball metastasis is seen in lungs. Cannonball metastasis is seen in the lungs. Okay. So with this, the lung cancers are also completed. We have done with the restrictive lung diseases, all the occupational lung diseases, the pneumoconiosis. Also, we have discussed about the lung cancers. So with this, the lung cancers topic as well as the restrictive lung disease is completed. Hope the class is helpful. See you in the next class. Thank you.